Good morning again. This is Dr. Bill Wyatt, and I'm going to talk to you some this morning about expanding dental arches, really. And I'm using dental, older patients, just to show you that you can expand anybody, really. Now, I've never started anybody at 90, but I do really believe that you could start at 90 and expand a 90-year-old person's dental arch. Uh, However, this gentleman here, we started at 79 and a half and ended up over in the 80s, and we expanded his arch with just arch wires alone. Now I may have used a Big Daddy arch wire. If you're familiar with this term Big Daddy, just students and people gave it the name. I didn't. It's just a large overlaid arch wire that we use for doing virtually all of our maxillary and mandibular expansions. And you can expand the lower anterior, you can expand the bicuspids, the molars, or anywhere you want to, really, with just outside, or I'm saying arch wires on the buccal surface and the labial surface of the teeth. And so it's not necessary to use a lot of the gadgets that are sold for expanding certain parts of the arch wire. All this, you can do it all with an arch wire, which is very cheap, and nobody makes any money off of selling them, so nobody tells you about it. But you can do that. Now, I am a general dentist, but I've been doing orthodontics now for about 42 years, nothing but orthodontics and temporal mandibular joints, work that goes with orthodontics. You can't really separate this TMJ work from your orthodontics. You almost have to do some of that to get along with it. Anyway, I'm here with the American Orthodontic Society. Now, this is an organization for pediatric dentists and general dentists, and our main purpose is to teach good, solid orthodontics to everybody. I mean, every dentist ought to know a lot about orthodontics. They would recognize it more, and the general public ought to have it out there where they can look at it. So if you have a problem like you see on these videos, and you think your physician or your dentist that's treating you doesn't know how to do it, well, take it and show it to him. He can look at it, and if you can have the correct thing done for you. A lot of times you're not offered all this because the person working on you may not be familiar with doing that. Nothing against the work. So anyway, I want to get into that. I'm using an older person here, and I don't want you to forget the buccal root torque that you need to put in there. If you want to bring a tooth out, in other words, if you're moving it in this direction and you're just pulling up here, you'll lean the crown out, and the tooth might make the root go, the tooth will rotate along here, along this part. As you bring the crown out, the roots tend to go lingual. Now, in the upper arch, that makes a lot of difference. You've got a airway up above. So if you've got a molar, a molar down here, and you pull out on it, you need to bring the roots out too. So this is what I'm stressing. It's not just simply the expansion of the tooth. If you push against a tooth, say somebody's like you've got an upper molar in here, and the molar is leaning, like if the molar had the roots out here and you push the crown over and got it under the roots, that's all right. But if the crowns are back here, the roots are back here, and now you push the crown out and the tooth rotates in here, then the root goes this way, and this is where your airway is, and so you cut down your airway a lot of times when you expand the molars if you don't bring the roots out. And so to bring the root out, I'm going to illustrate that with let's just draw a bracket slot in here, and that would be on the side of a tooth, a molar tooth or something in here, a bicuspid, it doesn't matter. Now you want this bracket to make the root of the tooth go in this direction. So you put buccal root torque in your arch wire. In other words, your arch wire might have no torque or anything back here, but we're going to put buccal root torque. So we're not going to use this arch wire like that. We're going to use it like such, like that. Now if this one was done that way, see, you'd have to flex the wire down and engage it into this slot. So now the wire is trying to do this. You see, it's gonna do that. Now wait a minute, I got you screwed up here. If we want the crown, in other words, we want the roots to go out this way, then we're going to have to do our arch wire like that, you see. Now we flex that down, and arch wire's wanting to come back this way, so it rotates the tooth and pushes it in that form. So as we expand with the arch wire and the buccal root torque's in there, the two go out together. This is kind of I've got confused myself there, but like if we want to take this tooth out, we put a bracket on the side. Now our bracket may have a slot, something like that in it. That's a poor drawing right there, not square. So we want to bend this wire so that the wire is wanting to do this to the tooth, you see. So if we do that, we'd have to have the wire kind of like this. Now you flatten it out and put it in there. And now this, if I flex this wire up like that, it's going to want to turn this direction. It's going to do that, and that's what I want it to do to the tooth. You can always go back and see that I just got in a hurry and drew it the wrong way right there. So we'd flex this wire down and engage it here, and that wire, if turned or loose, would make the tooth go out here. But if you put buccal root torque and you don't put some really good strength on the tooth, instead of the roots going buccal, they're in bone, the crown's out here in the air, then your crown will go this way. Your crown will move in. It'll end up being lingual crown torque unless you got something out here on the outside that's strong enough to overpower that and will bring the tooth parallel out like that, and that increases your airway. Hope that's not too confusing to you. I got confused myself, see, so I don't feel bad if you have to draw it out, to think it out. You have to think to do this stuff. All right, now I'm gonna go in here and we're gonna start to talking about this man. Here's an older gentleman now, and he's the nicest guy, and I just loved him, and he and I got to be great friends, and his teeth, he's younger than I am now, and his teeth were in pretty, they're not bad shape, but uh, he had some problems. Now, his bite is deep. He's got several other problems other than needing to be expanded. In other words, if we can expand these arches, you see, and that's what we're going to try to do, just bring this whole thing out, upper and lower. And we can do it with stuff out here. You don't have to buy a bunch of stuff to stick up in the roof of the mouth and all kind of mess. You just put it out here and it doesn't cost hardly anything. You just get a piece of arch wire. These, what we call Big Daddy arch wires, they'll expand anything living and walking that could get into your office. I don't care how old they are or anything. And you can expand this part of the arch, you can expand this, you can expand the molars, you can do them all together or more here, and expand the lower anterior by bringing the cuspids out. You can just expand any portion of the arch wire that you want to with nothing but about a 7-inch piece of 036 or 040 arch wire, and I guarantee you it'll expand anybody alive that you put that on there. So I hope you learned something about these arch wires. They're cheap. They don't sell for anything, so nobody is running big ads telling you how wonderful their gadget is that they're selling you. You can just get you a piece of wire. I don't know what it costs now, but maybe 50 cents in US money. You get it in a stick about 14 inches. You cut it in two, and it makes two of these wires, and you can expand anything. I just have not found anything myself, unless even if they're ankylosed. See, you can bring the whole bony structure out if the tooth is ankylosed even. You can move the tooth is on the bus, and you can move the bus. And when you move the bus, the tooth moves. Excuse me, I'm going to cough here. I better cut this thing off for a second. All right, we're back in business again here, except that I'll have to get my little red marking pen out, and I can't talk without drawing on here and showing you what I'm talking about. All right, let's get going. I got a lot of slides on this fella, and over a period of years, and showing you this several years after we got through with it. So anyway, here's some problems that he's got. He's got a deep bite, too deep. He's got his lower jaws kind of locked back. This cuspid really ought to go back here, and he's in a class 2 relationship, and it's too narrow. And there's a lot of things, not terrible here, but that need to be corrected. And on this side, we've got a class 2 situation also, and he's had a good bit of dental work. And you can see we want to take this arch and go out like this. Then you look at it when we're through and line all this up and expand the cuspids. You can expand the cuspids. Don't think you can't expand upper or lower cuspids and get them to stay there. You can put the root tip behind the crown, always, upper and lower. And I think that's what messed up the research. I think it's Dr. Little in Washington University. Just the nicest guy you ever saw, but he was misled in that, thinking that you could not expand the lower cuspids. and we've done it twice as wide as they were, and they stayed for 20 years, and they'll be there when they bury that lady. You see, all right. Now we got the lower needs some expansion. This tooth needs to be brought out here, and we got to expand these cuspids some to get these teeth to line up, and we'll expand the whole thing. I'm sorry, missing these. He could get some implants put back there if he wanted to, but at his age, I don't think he'll mind finishing up his life chewing on these. And so let's take a look at that, and we're going to go through a lot of slides here. So if you want to write it down, you don't have to, but I usually jot it on the x-ray or something and show what I'm going to do so I can remember it myself, those things. Okay, we're going to open the bite dentally. We're going to expand both arches, you see, and I put this Big Daddy in there. If your arch wire has strength enough to carry the tooth out with the buccal root torque, but the buccal root torque you put in an arch wire will tend to make the crown go lingual, and it moves easier in the air than the roots move in the bone. Just remember that. And so we put something big on here, and we put the rectangular wire in there with a lot of buccal root torque when we want to, and we bring that thing out. Now if your tooth is shaped like this, in other words your roots were out this way, then you would just bring it out and bring it under there. You wouldn't have to worry about that. But a lot of them, the roots are here, and you got to bring it over. And if you move this without putting that in there, then this will even go further, and that cuts your airway down. So you need the buccal root torque to bring the roots along with the crown. So got to keep hollering that. So somebody's going to put that Big Daddy wire on there, and they don't know how to keep the roots out. So I want them to learn how to. Okay, we're going to strand both arches and rotate the line. You just do that all the time to everything. You line them all up and coordinate the arches where you got to make the upper and the lower fit, and that's all that is. And we're going to come in each class 2, and we're going to correct the class 2. So if you want to write these things down or jot them down so you'll remember them, if you're seeing a lot of patients, you tend to forget what you plan to do, so I jot it on the x-ray, so I'll just see it immediately when I put the x-ray up when I'm working on a patient. Now you got these electronic x-rays and all this good stuff now, so things are a lot different. But here he is after we have treated him. See, we've gone through the treatment, and this is a few years later, and we got the braces off, so you can see how this has changed from what he had to start with in there. So I'm going to go in and later I want to show you the arch wires and stuff in there, except I didn't have any pictures of the Big Daddy arch wire in there. But here's his case here after he's finished, and that's the retention of that. On the lower we put the retainer like that in there, and here it is. This is 1998, and we started in 95, I believe, treating him. And this is further down the line. It's finished. Somewhere in here I've got the starting case. This is the this is the second x-ray. That's the cephalometric that we took back in 95. You can read it right up here. He was 79 and 5 months old at that time. So he went into his 80s on the treatment, Now when we get, you see when we finish here, we're going to have this lined up properly right in there. Okay, this is the second Panorex we've taken on the guy. Now when you get in here doing this, it's possible if you uncovered this tooth, if you could get it to come up in here, even at his age, you could bring this thing up here and you could set it up. You could set that tooth right in this area to occlude against that if you wanted to, and he wanted to take the time to get it over here. You could upright a tooth, and it doesn't matter how old they are either. Now we don't have, I don't know, that may be a wisdom tooth there. If it is, you could open this up and maybe get that tooth up into place right there. I didn't try to do that on him, didn't take that time. Now he's 80 and 6 months right now at this point. Okay, let's go ahead. Now, when I went to fix the class 2 problem, this was the way his condyles, I took pictures later because he just became class 1 overnight. You know, when we opened and raised the teeth and freed the lower jaw, it just came out to class 1, and I couldn't get him to go back. But here is the condyle now, and that's the fossa in here, and this is the ear opening back here, and on the other side the ear is here. Here is the condyle sitting right in there. Got a retrodiscal area is good, and he had no TMJ problem. And you see the condyle here, and then you see the condyle right here after it's open. Let me take those off, and maybe you can get accustomed to looking at them. You don't need to do this. I took that when he just jumped to class 1. I wondered what, I'm not seeing something, so I took some more of these transcranial x-rays, and I saw that my condyle was just staying out here. He didn't go back at all. When he opened it, went out to here. Same thing on the other arch. You see the condyle way down here, and when we opened it, it went on down here somewhere. I don't see it myself. It's somewhere right in that area, but the ears are back there. So we use a transcranial x-ray a lot of times. If we've got a TMJ problem, I would take transcranials on nearly every time. You may not have that to use that. They have a lot better stuff nowadays than they had when I was doing that kind of work. And this we shot from the back side, and you can see the condyles here. Now this is not necessary either, but I took those and enlarged. It was the right one, and there they are both together, and I think this was the left open, and there the condyles are again, with his mouth open, and you see he had no trouble with the condyles or TMJ problem. All right, here's the models on the gentleman, and we're kind of going backwards on this, but you see what we did. We just rounded this whole thing out, and I think I may have the and that's the lower model right there, and it's not as crowded, but it's some crowding, so we're going to have to expand the cuspids a little bit and line all this up, bring this in, push that back a little. It's not the orthodontics on the case isn't all that complicated or bad. And here we are in treatment. Now we've got these little bitty brackets, you see, and this is a plastic wedge. If I want to rotate this tooth in this direction, see, I slip that under the arch wire, and then I tie this down over here, and it's up here, and that makes the tooth want to go that way. So our staff knows how to do that real good, and I do too, and so we like to use these tiny little brackets because we have a big inner bracket space. You see, from there to there, and you can make a lot of more bends in your arch wire and still engage it. And the little arch, the O the 018 bracket slaughter 18 thousandths, I like that, and I do nearly all the work with a 17-2-5 rectangular arch wire at 17 thousandths this way and 25 thousandths this way, and that is big enough, and you can use that so much better and torque better with it. And if you have any big problems of bringing or expanding the arches, you put that big wire over the top of that and it'll expand anything. I have never found anybody that I couldn't expand their upper or lower arch with one of these big wires, and it doesn't make any difference. You could have ankylosed tooth in here. It brings the bone and the tooth out, and an ankylosed tooth can, if you move the bone, the tooth goes with the bone, see, so it'll expand that even. So don't think you got an ankylosed tooth. In fact, you could put a dadgum implant in here, and if you expanded the whole arch, the implant that is buried in, if you move the bone it's in, the implant will move. Now they will say they won't. Now if you get it running over into the basal bone, now that's a different thing. But if it's into the bone structure right around the roots of the teeth, it'll go with it, it'll move with it, anything in that bone structure. And the basal bone, if you move the alveolar bone out and it's taking weight, the basal bone adapts to that and moves out to support it over a period of time. But it takes a while to do that. But you can expand even the basal bone by gently expanding the alveolar bone, and then the force is hitting it at a different angle, and the body moves the basal bone out to where it can support the alveolar bone, and you can expand it by expanding the arch. Now, I'm not going to go out there in a matter of short time. I mean, it takes a while, but the body will do that. It'll move the bone out there with it. So anyway, we've expanded. This is 1996, and we started in 95, I think, on the guy. And we've got him out there by then, and we take this stuff off. I'm going to run through a lot of slides here with you. Now you see this where the brushing or whatever caused this. Now I've had that problem bad myself, and I've just had fillings put in there. Got good composite fill that where the enamel is over my teeth, and I'm 90 years old, and my enamel, I could live to be 200 years old, and I don't think I could wear the enamel out. You darn sure aren't going to wear it out brushing it. And I eat virtually anything I want to. I don't abuse them much anymore. All right, here we go again. This is 97, and we've expanded the lower arch and the upper arch. Got a little space in between there. And this is where we keep going out till we get these teeth lined up. This one has got to be rotated some more, you see. And you can see we got that on the arch wire to bend in more here. But it'll turn that tooth around as we get space up there to open it. All right, this is looking better. I'm going to run through this and go to the end. Now we corrected the class 1 relation. See the cuspid going right down in space, and prior to that it wasn't. And I think I've got some pictures. Okay, here's the upper arch. You see where it was this way. I don't know whether I did it there. Let me go back in this direction. Okay, here the upper arch was to start with, and here it is later. Now this is 96, and this was 95. In other words, we did all this. If you can just visualize in your mind where that is, and then look where it is now. Now, there are a lot of people would tell you you can't expand, you can't do all this, that, and the other. In fact, they didn't think you could straighten people's teeth until, you know, when you get past 16 or 17 or 18. Well, they didn't think their teeth were straight. That's just a bunch of bull. That's what, I don't know what, you know, I know people are listening to this all around the world, and that expression probably is crazy to you, but it's not right. You can do expansion. Now, if you look at these crowns of these teeth, they are level. The roots are up above here. And if you go back and look at the crown here, they're pretty much level here, see? But the teeth are out here somewhere. And now we carried the crown out and we carried the root with it. And that's what you need to know. If you expand the arch, you've got to carry the roots out with the crowns to make it work right. If you just tilt the crown out, the root will actually go lingual, and that reduces. Right above this is your airway, see? And you reduce it if you expand improperly. Some people say, well, I expanded the teeth and the breathing got worse. Well, yeah, if you tilt the root in when you bring the crown out, sure, it will get worse. You reduce the blooming airway when you did that. Now, here we've taken these teeth out, and the crown is level, you see. So the roots went out with the crown. And when it did, it widened the airway, and so people can breathe better. And it's mouth breathing that creates so much problem for us in orthodontics, you see. All right, let's hurry on now. The lower arch was like that, and we did it like this, you see. Now there's a pretty good difference in that. So now here's the lower arch. We're going in. We're just going to show that this is 03, and we started in 95, see. And so this is way after we got through. So it's still out there, see. It didn't fold up. Now we have them wear retainers. Now I'm going to run through this pretty quick. I need to get on with this, and you need to get away. But you see the class 2 correction just corrected overnight. When we freed the guy's jaw up, he just brought his jaw forward himself, and I couldn't get it to go back. Now there it is expanded. I'm going to run through this pretty quick. The upper 6, this is the upper arch again. You see we finally got that tooth rotated, and we put this little wedge in here pushing this back. If you want to use these little bitty brackets that I think starting out, you ought to have those with the wings where you can rotate a little better with them than you can these just straight brackets. Okay, let me go on here. Just looking at it, he's got a tooth there that needs to be fixed. I think he did do that. Let me go back. Did I mark that tooth with? I have to erase that stuff or it'll get stuck on there. Okay. And there we are looking straight at the upper after it's expanded. These are mirror shots now. that we're shooting at here. And there's the, after this is 97, and 97 down there, you see we've done that. It was 95 when we started, so it didn't take all that long to do his orthodontic work. And here he is in '03. So this is several years later, from say 97 or 95 to '03, and it's still holding up, staying. That's a gold crown reflection right there. You got some space in here. You could fill that in with some composite and close that space and make it look a little nicer if you want to. And we've got space between a bunch of them. And this is '03. We've got a little relapse in here, so he didn't wear his retainer as good as I would like for him to. And this is changed a little too right down here. So I don't know whether we made him go back and wear the old retainers, or no, it looked like we built him a retainer to fit it at this point with a new bite blade on it, and just let that little flaw stay there. And down on the bottom he's got some flaws in that too. Okay. That's 95, 93. Okay. Now I think we're going to finish this up. This is where we started. See, you needed to do that. Well, the lower jaw is locked back there. But see the contact right there. You can see where that is. So he can't come forward. When we raise this up and lower this and free this up, his jaw just moved forward. See, this is the 6-year molar here, and it should be over here somewhere, you know, something like that. And when we freed that up, it did do that. Now it's going to leave this tooth sitting in the breeze back here. Now if there's a wisdom tooth back here, I would love to get somebody that's this old and we could bring their wisdom tooth up and put it underneath there, because I know you can do it, you see. Now let's see, this is show you the finish. There it is. This cuspid's right down in there, and there's this 6-year molars up on that side. We've raised the teeth, our overjet and overbites considerably different. We've expanded all this thing, and that was done. It started in 95, and by 96 or 7 we had this pretty well done, and it's held up. This tooth's not just right. I don't know, they did a crown. It doesn't look all that well positioned to me. Right there we are on the left side of the mouth, and we're not as far off over here. This tooth could come out like that, and then you need something to wear underneath there, under this, to keep that tooth up back there, and you could make a little retainer with some pads back here if you wanted to. But let's see what we did. Now there it is after we got through. Somewhere or another that tooth staying up there. This is '03. I think that's '03. It's just been written on there. Now there's the 95. You see the crowdedness in here. There it is in '03. Oh, that's the upper arch, I'm sorry. But it's expanded out there. The lower arch is here, and that's the lower arch there. And here it is, and I think this may be the end of this picture, but he was, in 95, he was 79.5 years old. And this bone moved good. I did not take a long time to do the case. It worked great. If he had been 90, I do believe I could do the same thing with this man, but I never got a chance to do that. And this was '04 when that was taken, and I do believe that's the end of this. Let me see. Yes, it is. So I hope you will look at this. There are several things that you need to know. You've got to use the buccal root torque. You can expand anybody. I mean, from teenager or any child, of course, there's no problem at all to do that. And you can move these teeth around. You could expand an arch even if you had ankylosed teeth in it, as long as the ankylosed tooth is not connected to the basal bone structure. If it's in the alveolar bone, you can move the whole alveolar bone out as you expand it in there. And these are some things that people wonder about knowing. You can expand anything you want to that I know of. I've not found anything. Now, I like to use palatal separators. They do a job in pressure that are doing. But the cost of something to expand with on the outside is almost nothing. It costs you about 50 cents for one of those arch wires. And you will spend buku dollars if you buy all the gadgets that you do. And I'm not kicking people that if they can find somebody that'll buy them, they want to make them and sell them to them. That's okay. I'm not kicking making money out of this, because you got to make enough money to keep yourself going in it, you see. But these are some things that you need to learn from this video. So I hope you'll pick up some of these, and I've enjoyed sharing it with you, and I might as well share it because I won't be around too long to enjoy it otherwise. But I hope it will live on in different people. So thank you for listening, and I'm going to hush up here and let you go, and I'll go over here and stop this thing, or try to. Okay.